Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, and we're going to be covering pharmacology. To be more specific, we're going to be going over antihypertensive agents. This is definitely going to be a multiple part series because I think on this video, I'm covering about 14 slides, but I have so many different drug classes to go over in depth that you absolutely need to know if you're taking pharmacology or you're preparing for NCLEX. So this is definitely going to be a multi-part series. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. So go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for Next Generation NCLEX Review Session Part 1 and Part 2. In part one, I teach you how to think critically. I go over prioritization and delegation and different scenarios that NCLEX may present before you and where your mind is supposed to be going. In part two, we go over actual NCLEX type questions, rationales, and how you need to apply them to the type of questions that you're expected to get. You can also sign up for a private consultation session. Maybe you want to pick my brain about something, or maybe you need private tutoring. If you want private lessons with me, you can sign up for that. I book very quickly, but you still have that opportunity. If you're currently in the nursing program and you're really struggling and have to do really, really well, check out the audio lessons that I have available. Check to see if I have any lessons that actually cover what's going to be on your next exam. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, right here, YouTube. My handle is the same everywhere. It's Nexus Nursing. All right, guys, without any further ado, let's get started. Antihypertensive agents. First question. Which drug class ends in pril, such as captopril, lisinopril, benazepril? That actually says benazepril, but you get the gist. Which one is it? Your ACE inhibitors, your calcium channel blockers, your ARBs, or your vasodilators? Very good. Your ACE inhibitors. So, April, if you are watching, it's been all these years later, and I'm still talking about you. When I was in nursing school for my LPN, I was in the nursing program, and the class was split into after every single exam, everyone wanted to know what I got and what another girl got. Her name was April. April was Jamaican, so she represented the Jamaicans, and I was Haitian. I am Haitian, so I represented the Haitians. And so it was like a competition to see which island, because if April got 100, I got a 99. If I got 100, April got a 99. We were always like neck and neck. So it was a friendly competition. But I would always remember April always aced her exam. So when it comes to ACE inhibitors, I'm going to look for those drugs that end in pril. April, ACE, get it? Okay, there you go. So ACE inhibitors, they end in pril. Look at our other options. We have calcium channel blockers. We have ARBs, vasodilators. I won't go into detail about them now because we're going to talk about them in other slides. But these other types of antihypertensive agents, you absolutely need to know those drug classes. You absolutely need to know your nursing interventions, adverse effects, and patient teaching for each and every one of those. And you have to know what drugs fall into each of those drug class. Don't don't shoot the messenger. I'm just letting you know. You're going to see it. And it does not matter which state you're testing in the United States, in every single state, expect to get at least a couple questions on antihypertensive agents, okay? All right, select all that applies. The pressure in the cardiovascular system is determined by which three elements? Select all that apply. Here are your options. Heart rate, stroke volume, peripheral resistance, and oncotic pressure. Again, the pressure in the cardiovascular system, what is it determined by? It's determined by three things. What are those three things? Heart rate, stroke volume, peripheral resistance, and oncotic pressure. If you guys weren't able to make it into the Kahoot, You guys can still participate on the live. Just type in your answer on the live. We listen, we don't judge. Well, I judge sometimes, but it's all in love. Very good. I'm so proud of you guys. So, yes, the pressure in the cardiovascular system is determined by three things. It's determined by your heart rate, it's determined by your stroke volume. Your stroke volume, guys, is the amount of blood that's being pumped out by the ventricles each heartbeat. And then, of course, your peripheral resistance, that's the resistance of the arterial muscles from that blood that's being pumped out. Those are the three things that determines the pressure within the cardiovascular system, not oncotic pressure. However, you still have to know what oncotic pressure is. So oncotic pressure, guys, that is the pulling force. So you know how you have your blood? Well, part of your blood is plasma. The plasma portion of your blood is protein, and the protein has a pulling force. That's what keeps that fluid pulled in within the vessels, okay? Angiotensin 2 receptor blockers, your ARBs, they end in what? Is it peen? Is it sartan? Is it lol or statin? Your ARBs, what do the ARBs end in, guys? Very good. Sartan. Those are what your ARBs, and this is also another type of antihypertensive agents. So those drugs that end in peen, those are going to be like your calcium channel blockers. Those drugs that end in LOL, those are your beta blockers. And those drugs that end in statin, those aren't even your antihypertensive agents, those are anti-cholesterol drugs. Okay. You guys have to know these drug classes. You have to know the drugs that fall under these drug classes. Again, adverse effects and nursing interventions. Those are biggies. Yep, losartan. All right, select all that applies. Untreated hypertension increases a person's risk for what? Select all that apply. Here are your choices. Coronary artery disease, stroke, cardiac death, renal failure, blindness, xerostomia. Again, untreated hypertension increases a person's risk for what disorder? Coronary artery disease, stroke, cardiac death, renal failure, blindness, xerostomia. What do you guys think? You guys are doing great on the live. Okay. Everything except for xerostomia. Hypertension that remains untreated can cause all of them. Coronary artery disease. Remember, guys, your coronary arteries, those are vessels that actually, just like every organ in your body has to be perfused, it needs oxygen, vitamins, mineral nutrients. So does your heart. So those coronary arteries, those are the vessels that actually feed, that perfuse the heart. Okay, it can cause coronary artery disease. It could cause stroke, cardiac death, renal failure, and absolutely yes, blindness. Think about these tiny, 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 tiny little vessels you have in your eyeballs. Absolutely. The only one it does not cause is xerostomia. Xerostomia is a condition where a patient has dry mouth. Now, dry mouth can be caused by many things. Dry mouth can be caused by medication such as anticholinergic agents. Remember, I taught you guys about that. Anticholinergics can't see, can't spit, can't pee, can't right? So xerostomia can be caused by that. It could be caused by, some antidepressant agents. It could be caused by some antihistamines. So when it comes to xerostomia, you're going to teach the patient to chew on sugarless candy because xerostomia is dry mouth. The candy is going to help them, create the saliva, but we don't want to turn them into a diabetic. So that's why you're going to have them chew on sugarless gum or suck on sugarless candy. Anyway, back to the hypertension. Untreated hypertension can cause everything on this list except for xerostomia. Select all that applies. Black patients, including diabetics, would benefit from thiazide diuretics before initiation of two drugs. Select all that applies. So when it comes to Black patients, they benefit more from thiazide diuretics before what other two drugs? What are those two drugs? Select all that apply. And here's what's so crazy, guys. You guys have to know this for NCLEX. But if you go further and decide you want to be a nurse practitioner, you're going to see this again. You can't run away from it. This is very important. You have to know it. Very good. ACE inhibitors and ARBs. When it comes to Black patients, studies have shown thiazide diuretics and calcium channel blockers are much, much, much more effective and should be ordered first for the patient that's hypertensive before ACE inhibitors or ARBs. Okay? Thiazide diuretics and calcium channel blockers first. They're much more effective before ACE inhibitors or ARBs when it comes to Black patients, including diabetics. Select all that applies. Non-Black patients, including diabetic patients, may initiate treatment with which 4 drug classes? You're going to choose 4 of them. Non-Black patients, including diabetic patients, which 4 drug classes would you expect to be ordered? We have vasopressors, beta blockers, thiazide diuretics, calcium channel blockers, ACE inhibitors, ARBs. And guys, you're not the one prescribing this drug, but NCLEX absolutely expects you to know what you would expect and what you would challenge or question. Okay? So when it comes to non-Black patients, studies have shown, non-Black patients, including diabetic patients, studies have shown which 4 drug classes would you expect to be initiated first. And this is another one, guys. NCLEX also for your NP. You'll see it again. You can't run away from this one either. Okay, let's talk about this. Thiazide diuretics, calcium channel blockers, ACE inhibitors, and ARBs. Those are the two. Those are the 4 that have been shown to be most effective. And so current guidelines starts with these 4. Those are one of the 4 that you would expect to be ordered. Select all that apply. Which 2 drug classes are considered drugs of choice for an adult hypertensive agent? I can't speak. For an adult hypertensive patient that has chronic kidney disease. Select all that apply. So you have to choose 2 drugs. Which 2 drugs are considered the drug classes of choice if the patient is an adult and they have chronic kidney disease? This is another one. You have to know this for RN and you have to know this for NP. Which 2 drug classes, guys? I'll give you a hint. They both have protective properties for the kidneys. ARBs and ACE inhibitors. Yeah. So you guys have to know what you're not, because you don't get too many questions that are like race-based for NCLEX, but there are a couple that you absolutely have to know. When it comes to the antihypertensive medications, you got to know which ones you're going to stay away from Black people, which ones you're going to give to non-Blacks, you expect to be given to non-Blacks, and which one you expect to be given to patients who are hypertensive, but also have kidney disease. When it comes to kidney disease, it's going to be your ACE inhibitors or your ARBs. Don't say I didn't warn you. Select all that apply. I'm killing you guys with select all that applies tonight. Which two drugs should never be used together in the same patient? Select all that apply. Vasopressors, diuretics, ACE inhibitors, calcium channel blockers, vasodilators, ARBs. Two drug classes that should never, ever, ever, ever be given in the same patient. Very good, Mavila. If you see these two drug classes ordered together, are you going to give them to the patient like a robot? No, you're going to question that order because you know they're never supposed to be given together. It's one or the other, never together. Oh, you guys weren't too sure. The correct answer, ACE inhibitors and ARBs. These two drugs are way too strong. They have a synergistic effect. So synergistic, that means like when the drugs are given together, it's way, 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 way stronger than we want it to be, right? So you ever see ACE inhibitors and ARBs ordered for that same patient, you're going to withhold that medication, place a phone call to the healthcare provider for clarification. Now, before I move on to my next screen, that reminds me of another famous NCLEX question. So this is something you guys have to know. If you're taking pharmacology right now, chances are you're going to get this question somewhere um, within that class as well. If you have a question about a drug order, so for example, the healthcare provider ordered an ACE inhibitor and an ARB to be given to a patient. You know you're not can't do that because you don't want to lose your license, right? You're going to withhold that medication. You're going to call who? The healthcare provider because they're the one who wrote the order. If you have a question about an order, about a prescription, you call the healthcare provider. If you have a question about a drug, a side effect, an adverse effect, a therapeutic level, if you have a question about the drug itself, you never call the healthcare provider. You have two options. You're going to call the pharmacist or you're going to check the drug guide. Those are your two options. If you have a question about the drug, you're going to check the pharmacist or your drug guide. If you have a question about the order or the prescription, then you're going to check with the healthcare provider. Make sure you guys know the difference. All right, which race is more responsive to single drug therapy as opposed to combination drug regimens? Black patients, white patients, Hispanic patients, Asian patients. Which race is more responsive to single drug therapy as opposed to combination drug regimens? And by the way, guys, listen, my life is submerged in nursing. So I don't keep up with the politically correct way to say things. So I'm sorry if I said black and white and we're using something else. You know what I mean. I'm not trying to be rude or disrespectful, okay? But you know what I mean. All right. The correct answer is Black patients. So when it comes to Black patients, studies have shown that they're much more responsive to single drug therapy than combining drugs together, right? Where studies have shown that for non-whites, especially non-whites, for non-Blacks, especially white patients, they're more responsive to combination drugs. Okay? You guys following me on the live? Okay, good. We still say Black. Okay. All right, let's keep going. All right, which race is less responsive to ACE inhibitors, ARBs, renin inhibitors, and beta blockers. Black patients. I told you guys what they're most responsive to. It's going to be the thiazide diuretics and the calcium channel blockers. You have to know this. I'm telling you, you're going to see it somewhere within your nursing career. I promise you. Make sure you know this, okay? And by the way, guys, everything I'm going over here, it doesn't matter which pharmacology textbook you're using, who the author is, what the edition is. I bet you 90% of these questions I'm going over, if you check your pharmacology book, you're going to see this information. Of course, you're going to see it in text, but guess what? You're also going to see it in a table, a diagram, a chart, an illustration, a box, a nursing alert. You're going to see it in a secondary form. Why? Because it's important. Why? Because the chances are very high you're going to get a test question on it. And so the author wants you to see this information in several ways because it's important to remember. Go check. All right. What is the first line drug class of choice for Black patients? Is it diuretics, vasopressors, calcium channel blockers, vasodilators? So I already told you the two, but if you had to choose one, what is the number one drug class? It's diuretics, guys. Diuretics. Now, let me be specific. Can you tell me what kind of diuretic? You got to know this both for RN and NCLEX. Can anyone? Thank you. Very good. Thiazide diuretic. Yep. Thiazide diuretic. All right. What is the name of the type of hypertension that has an unknown cause? Is it white coat syndrome? Is it essential hypertension? Is it fixed hypertension? Or is it flexible hypertension? Essential hypertension. So patient's hypertensive, but there's nothing specifically that we can point to that say this is the cause. Okay. White coat hypertension, guys, that's when the person, their blood pressure goes up because they're nervous. Their blood pressure has been fine all week, but the minute they go to the doctor's office and they see the white coats, all of a sudden their blood pressure is going up. And so that's why when it's suspected the patient has white coat syndrome, you do what? You teach a patient about keeping a blood pressure log, a blood pressure diary. Because when we check the diary the next time you come in for a follow-up, and we see every single day, twice a day, 3 times a day, you check your blood pressure is fine. And the only time it's through the roof is when you come and see your healthcare provider, most likely what's happening, white coat hypertension. We're almost done, guys. Select all that apply. What factors are known to increase the blood pressure? Here are your options: high levels of psychological stress, exposure to high frequency noise, high salt foods, lack of stress, genetic predisposition, and marital status. I wrote lack of stress, but something's telling me I meant to say stress. I'm not sure. Ooh, guys, don't be mad at me. Pinto bean. Mm. I think I meant to put lack of rest, or maybe I just meant to put stress. I'm sorry. I apologize. But anyway, so the factors known to increase blood pressure, yes, high levels of psychological stress. If you're in a relationship with a narcissist, your boss is a narcissist, someone psychologically torturing you, that's going to increase your blood pressure. Exposure to high frequency noise, that can elevate your blood pressure. High salt foods. Matter of fact, another famous test question, they'll give you a situation about a patient that's hypertensive and what kind of foods would you teach a patient to avoid? You need to know anything that's in a soup is going to be high in salt. Anything that's packaged is going to be high in salt. Anything that's frozen is going to be high in salt. Um, what else is high in salt? Basically, when you walk into the grocery store, anything that is in the middle is going to be high in salt. What's going to be low in salt? Everything in the periphery of the store, such as your fresh fruits and your vegetables. Chips, high in salt. Anything that has to be preserved, high in salt. Okay. Um, High stress, that's going to cause your blood pressure to go up. And of course, genetic predisposition. Race, being black, that is a high risk factor for being hypertension, being hypertension, being hypertensive. Gender, being male, that is a risk factor for being hypertensive. So or having first degree relative. So genetic predisposition, that also is a risk factor. Not marital status. The fact that you're married or not married, that's not a risk factor. Now, you may be getting pressure from family members or loved ones for being married or not married, but the actual status itself, that's not a risk factor for hypertension. Yes, thank you for mentioning that, Matthew. Non-modifiable risk factor. That's something else you guys have to know about the risk factors for hypertension. You have to know the difference between the modifiable and the non-modifiable, the risk factors that you actually can change versus the risk factors that you have no control over, such as your gender or genetics. Last question. Select all that apply. Which two types of ACE inhibitors are associated with pancytopenia and airway obstruction? This mostly happens in Blacks, but it can happen in anyone. It's been known to happen across the board, but we tend to see it happen more in Black patients. Hence one of the reasons we stay away from ACE inhibitors when it comes to Black patients. But which two types of ACE inhibitors are associated with pancytopenia and airway obstruction? Is it lisinopril? Is it perindopril? Is it benezopril? Or is it captopril? All right, most of you guys got the lisinopril, but you didn't get the other one. It's perindopril. These two guys. Okay, so pancytopenia, let me tell you what that is. Whenever you see a word you don't understand, just break it down. Pan, covering everything. Cyto, cells of. Penia, a little bit of. So when a patient has pancytopenia, they have a little bit of all of the cells, a little bit of the WBC, a little bit of the RBC, a little bit of what's the third type of cell? Platelet, right? So if you have a little bit of RBC, you're going to be at risk for, anemia. You have a little bit of WBC, you're going to be at risk for infection. You have a little bit of platelet, you're going to be at risk for what? Bleeding, pancytopenia. So these two drugs specifically puts the patient at risk for pancytopenia and airway obstruction. Can you live without breathing? Absolutely not. So make sure you know these two drugs specifically, the lisinopril and perindopril, which are ACE inhibitors. They are associated with the pancytopenia and airway obstruction. There is so much more I have to cover with you guys when it comes to the antihypertensive agents. So this is going to be a two, maybe even a three-part series. So keep your eyes open for that. How are you guys doing on the live? Okay, let's see how you guys did.